Finally, we're going to have Denese Shervington, who's come all the way from New Orleans, whose work looks at stressful life events post-Hurricane Katrina.
I'd like to thank the HERON team for inviting us to come speak about some of the work that we're doing in New Orleans. And I'd like to thank the New Orleans team, in particular the research and the evaluation team, without whom I would not be able to be here speaking with you today, and Dr. Hatch, who acted as our consultant. And I would also like to thank program officer from the foundation who has made this work possible. Okay, so I also want to share that this work is not a research project. It actually started from a program we were doing and recognizing the need to collect some data to think about what might be additional services that young people need. I think luckily we were smart enough to get the kind of data that when the research team looked at it, they said, we need to be analyzing this and we need to be telling some stories about what we're finding. So just a little context for you in New Orleans. Everyone here knows about what happened in terms of the hurricane and the flooding, and just want to underscore talk about inequity, the very unequal treatment that people who were poor, and particular people who were of color, received during the recovery and continue to experience. So currently in New Orleans, our population is around 369,000. We're now, the city used to be much blacker than it is now post-Katrina. We're at 60% approximately African American. Before Katrina, it was probably around 70%. All I can say is that we're poor, and a lot of our children in New Orleans live in poverty. And there's also a lot of violence. The murder rate is 10 times the national average. A little bit about the organization that I work with. We are a community-based nonprofit organization. We'd been in New Orleans before Katrina. Our mission to improve the physical, mental, and spiritual health and quality of life for women, in particular women of color and their families. We consider ourselves a translational public health organization, rooted in community, but going between institutions of public health and academia. And we believe in using a participatory action research philosophy as a conceptual framework guiding all our programs, meaning that we see ourselves working in partnership with the communities whose voices we are trying to understand. In 2010, we received a grant to do teen pregnancy prevention work in New Orleans. Knowing the post-disaster mental health crisis that we were having in the city, we decided that we needed to do something else. Also knowing that sexual risk-taking is also very connected to one's emotional landscape. And so with our Collective for Healthy Communities, we decided that after we did the standard 8-module intervention for teen pregnancy prevention, we were going to do a screening of young people for post-traumatic stress disorder, for depression, and for exposure to violence. And based on that, determined that these young people need more services than we were able to give. And also, we added two brief lessons on emotional wellness. So we started implementing this emotional wellness screener in September of 2012, and it's going through currently. And In order to look at youth mental health needs, we, of course, collected demographic information. As I mentioned earlier, the frequency of exposures and outcomes, and in particular, look at depression and PTSD. And I'm gonna, those of you who are into statistics can read the last two bullets. And so we've implemented these screeners at 19 schools, a church, and some community-based organizations, and where we do summer camps. And basically, in terms of our demographics, is 54% girls, 45% boys. The young people are from grades 5th grade through 11th grade, so they're approximately 10 through 16, 17. The mean age is 13, and they're predominantly African American. It's predominantly African Americans who are in the public schools in New Orleans. And in terms of witnessing violence, as you will see, there's a high exposure to violence, young people witnessing violence. 29% have seen violence between their parent and partners, 12% between parent and siblings, 40% in terms of witnessing assault, and 18% murder. And you'll see that males are more exposed than report more exposures than females. In terms of experiencing violence, 6% of our sample reported forced sexual intercourse, and 5% reported dating violence. When we did a later analysis of this current year, and we were a little more, we had more parameters around sexual violence, we saw an increase in report from girls. In terms of knowing someone who's been murdered, we see that a large percent, more than half of our population have been exposed to knowing someone who's been murdered. And I oftentimes am in schools and conversations with young people, and they're talking about their parents or someone they know really well. So this is really quite close to them. Females reported more exposures than males. And we asked them about worry, what they worried about, and you can see that 52% of our sample reported being worried about their personal safety. Something that was really bothersome to us is the amount of young people who worry about not being loved, 29%, about a third of them, and about 16% worry about lacking food or home. And you will see that females report more worry than guys. And I see my 2 minutes, I'm going to run through real quick. In terms of mental health symptoms, and these are screeners for signs and symptoms of PTSD and depression. And you see that in the total sample, of course, girls more than boys, 8% overall reported symptoms for which they could potentially be diagnosed as being depressed. In terms of lifetime PTSD, 22% of our sample reported symptoms, again, that could be, if diagnosed further, could potentially be post-traumatic stress disorder, and 13% were reporting current symptoms of PTSD. That is quite troubling. This is 9 years post the disaster, and these symptoms of stress have not resolved in our population. And about 14% are reporting suicidal ideation. In the general population in the United States, the level of PTSD is about 8% lifetime in the general population, and about 3% current. I have 1 minute left. Exposure to violence, you see, I could just say you'll see that there are the cumulative, that young people are reporting about 5% have been, I'd say about 3%, I'm sorry, have been exposed to cumulative about 5 or more experiences with violence. So, what my statistician wanted me to say, that all that was important in this was to say that what we found, that young people who are worried versus their experience with exposure were more likely to endorse symptoms of depression and post-traumatic stress disorder. And that's really an interesting phenomenon, that maybe it's the internalization of the stress that's creating the potential for developing a mental disorder. So just in summary, and maybe because I'm the last speaker, I could have 1 more minute. Can I ask the conference? That there are high levels of trauma among our young people in New Orleans. And the concern is that this is going to perhaps evolve into later life, later course, significant mental disorders, depression, anxiety, and substance abuse, and could potentially lead to interpartner violence, whether it be the perpetrator or the victim. There's a large amount of school and community violence, and I'll keep going. The one thing I do want to say is, in terms of the work that we have felt that we must do, is because for a large proportion of the population in New Orleans, especially those who were poor and African American, the city did not come together to provide the kinds of assistances that are needed to promote resilience. And so this has actually, a lot of nonprofits in the area are the ones who have really taken the task to see what can we do to promote resilience, in particular in young people who we know are going to have more exposure to the disaster that they experience than us who are adults. And so this is part of the work that we do and continue to do. We focus on young people a lot because they have been the ones who have not been attended to, their needs have not been attended to. Our mental health system got totally destroyed during the disaster. It has barely come back, not sufficiently to meet the post-disaster needs of our citizens. And so our organization has been trying to fill some of that slack. And we primarily focus on young people, especially in the school setting, because we know that's where they are, where they're captive. And a lot of the research shows that you actually have a good opportunity to work to mitigate and build resilience for young people in the school setting. Thank you very much.